Is prednisone a poison? Why is prednisone even allowed to be on the market? I'm Dr. Megan, your prednisone pharmacist. I'd like to talk about how prednisone can truly be poisonous for some people and how to make it feel less poisonous. So this is inspired by a question asked on YouTube by a commenter. It said, I feel like I was almost murdered by prednisone for a week. I got it for knee pain. 3 weeks of hell now. When will this end? Or am I ruined and I will die soon? I cannot get any help from the emergency room that gave me this poison. How is it that a poison like this is allowed to be put in humans or animals? I am mad as hell for being poisoned like this. Are these direct effects, or am I experiencing withdrawals from a week's worth of this poison? What a powerfully horrible experience this person is having. I know so many people who've had a miserable experience like this. And so I want to talk directly to those of you who are struggling so much from the horrible side effects that even a short-term dose of prednisone can cause. Just a week's worth of this poison is making this person feel horrible. And so first, let's talk about how is it allowed to be given to humans or animals. And yes, prednisone is often given to dogs, especially, sometimes cats, but I'm going to talk specifically to how is it allowed to be given to humans. Now, what's interesting about prednisone is that it can be prescribed by nearly any doctor. It's not like a really unique, fancy chemotherapy drug that's only prescribed by cancer doctors, or a really refined, cool drug just for heart patients, so only a cardiologist would prescribe it. Prednisone works for any kind of inflammation in the body. And so any kind of doctor can prescribe it because it can be used anywhere. In your eye, in your brain, in your lungs, in your throat, in your heart, on your skin, in your immune system, on your joints, your liver, your kidneys, and on and on. Prednisone can be prescribed for any kind of itis, I-T-I-S, any condition that ends in itis, whether it's arthritis or myocarditis or nephritis. Any kind of itis condition or osis condition, inflammation and swelling conditions, prednisone can help. Or autoimmune conditions. Prednisone can help with so many things because it is mimicking your body's naturally occurring hormone called cortisol. Cortisol is this amazing hormone that your body makes to help you deal with stress. Everyday stress, and more specifically, long-term life-threatening stress. So that could be famine or war. It helps you survive those times. And it does so by affecting up to 2/3 of your genes. I was mind blown when I read 2/3 of genes are affected by cortisol. And it's helping you survive. Prednisone's job is to mimic cortisol to help you survive. That's it. It is not helping you cure whatever the condition is. It's not helping do anything but simply survive. And it's doing so at a huge cost. It's causing more side effects than any other drug. There are at least 150 side effects of prednisone. But we don't actually really know that because prednisone is such an old drug that nobody's ever really tested it to find out precisely what side effects are caused by it. So we do know that it causes way more side effects than any other drug, and that some of those side effects are completely debilitating and horrible. The people can go from being a totally normal person to taking prednisone, and suddenly they can no longer be around other people because their anxiety and depression and mood changes are so dramatically debilitating. They can't even be around themselves. They feel like they're going completely crazy. And it's not your fault. It's prednisone's fault. It's keeping you alive by making you feel crazy. Not everybody gets that, but it's almost completely rare that people get zero side effects. Everybody gets a side effect to prednisone, and lots of people get lots of side effects to prednisone. And so the reason this poison is allowed to be given to humans and animals is because it works. It works to keep us alive, to help us survive. It kept me alive. I was going to die. If I had been born before prednisone existed, before modern medicine, and had my autoimmune condition attacking my platelets, I would not be alive. My body was attacking my blood cells from the inside out, and I was bleeding. Your normal amount of blood cells, the platelets, is 150 at the lowest, and I had 3. I would have just bled to death without prednisone. And so prednisone is a miracle. It truly is. It saved my life, and it has saved so many other people's lives, not necessarily their lives, but their ability to function. That people with rheumatoid arthritis are suddenly able to open cans and cook for themselves instead of being stuck in bed in debilitating pain like many of my ancestors would have been. The question, are these direct effects, or am I experiencing withdrawals from a week's worth of this poison? Yes, probably both. Probably you're having direct side effects, but you're probably also having withdrawals. Withdrawal symptoms include feeling kind of the same symptoms as if you got the flu. You feel fatigue, you're exhausted, all you want to do is just be on the couch. You feel joint pain, like shoulder, neck, back, maybe wrist or elbow or shoulders or hip pain. You might have muscle pain. You might have a low fever. You might have insomnia or mood changes. You might have weight loss because you're not eating. You have no appetite. There's a lot of symptoms that are possible. The problem is all of those symptoms just sound like you have the flu. And so it's really hard to tell if withdrawal is something else or if it's actually prednisone withdrawal. And in fact, when I first started taking prednisone, and even when I stopped taking prednisone, I didn't even know prednisone withdrawal existed. I'm a doctor of pharmacy, a board certified ambulatory care pharmacy. I should know this. And I had never heard of prednisone withdrawal symptom. Heard of opioid withdrawals, heard of benzodiazepine withdrawals like Xanax and morphine, but I'd never heard of prednisone withdrawals. And I think that I'm not alone. I think that most healthcare providers have never heard of it. And so when you're saying, I took prednisone and now I feel blah, 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 they don't know that you're suffering prednisone withdrawal. They have no idea. They don't even know what to do for you. So let me explain some options of what you can do. Option 1 is you can just tough it out. I don't know how well this works. There's no studies showing how well that'll work, how long it'll take. Nobody knows. And it might take a year. If you want to tough it out for a year, go for it. I personally have no tolerance for that kind of suffering. And so in my situation, would rather go back on the prednisone. Or there's option number 2, which is to slowly taper off the prednisone. So this person took prednisone for a week and now they've been suffering for 3 weeks. So that means whatever dose they were given, say they started out at 40 and then the next day they took 30 and the next day they took 20 and the next day they took 10 and the next day they took 5 and then 2.5 and then 0. Well, for that person, that was too fast. Going from 40 down to 0 in a week was too fast for that person's body to react. And so in that case, you'd need to taper off slower. So instead of going all the way down in a week, maybe each of those drops should take a week. So 40 to 30, that's a week. 30 to 20, that's a week. 20 to 10, a week. Down to 5, that's a week. Down to 2.5, that's a week. But the most important thing to note here is the percentage drop. So from 40 to 30, that's a 25% drop. And that's okay. Most bodies can handle that kind of a drop. But when you go from 10 to 5, that's a 50% drop. And for a lot of people, that is way too dramatic. We need it closer to a 10 to 20% drop if you're suffering withdrawal symptoms. And that drop can be 1 day, 3 days, a week, 3 weeks, a month, or longer. And there are some great tapering strategies. If you'd like to download my taper chart, it's free, printable, and it has the best strategies for tapering. So just click the link below to download my Prednisone Taper Chart now. And you can just print it off and put your current dose and choose whichever strategy seems to fit your situation best. Signing off as Dr. Megan, your prednisone pharmacist.